Welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Happy Monday and welcome to Brain Chat, friends. I'm so excited to be back with you after a couple of weeks of not having the show. I'm very excited to be back for our December edition, and we have got an amazing and very exciting topic to discuss today. I hope that everyone had, a wonderful Thanksgiving a couple of weeks ago, that everybody's getting ready for the holidays. You guys know how we do on Brain Chat. Tell me in the chat where you are logging in from. I bid you greetings from rainy Atlanta, where I think we are currently in winter, but I'm not sure because sometimes we have fake winter and fake fall and all that good stuff. But very, very excited for the holidays coming up. I hope that everyone has good plans to spend time with their family and friends. All right, so on today's episode, we are going to talk about integrative medicine, and I am so excited to have a world expert on this topic as it pertains to MS, Dr. Alan Bowling. And so I am going to read his intro, his bio, and then we are going to get right into our program. So Dr. Alan Bowling is the director of the Neuro Health Institute and is a clinical professor of neurology at the University of Colorado. He has devoted his career to developing evidence-based information about unconventional and lifestyle medicine and creating models for using this information to provide integrative neurologic care to those with multiple sclerosis. He has more than 100 lay and professional publications, including 5 books. You heard it right, 5 books. He graduated summa cum laude from Yale, where he obtained his MD and PhD degrees. He did residency training at the University of California, San Francisco, and his fellowship training at Mass General Hospital, Harvard Medical School. In 2016, he received the Neuroscientist of the Year award from the Colorado Neurologic Institute. And I hope all of you are excited as I am about this topic. Welcome, Dr. Bowling.
Great. Thank you. Pleasure to be here.
All right.
Thanks
Welcome
for inviting
to
me to be part of this.
Yep. Yeah, absolutely. So I'm super excited to talk about this topic. This is the first time we've discussed integrative medicine on Brain Chat. And so before we get started, I always ask my guests, tell us a little bit about yourself and how you got into working with multiple sclerosis patients.
Yeah, so it relates to the very formal training CV information you just gave. There's a whole backstory to that, which is I'm currently in Colorado, and I grew up in Colorado. So I grew up in Colorado in the 60s and 70s, and people back then in Colorado were very lifestyle oriented. They were even back then really interested in exercise and healthy living and healthy diet, and smoked a lot of marijuana back then. They did, people in Colorado, and used unusual herbal treatments. And so that's kind of what I grew up in. And then I spent 20 years doing what you just described, not in Colorado.
Right.
And then I decided to come back home and provide neurological care to people with MS where I grew up. And I thought, my gosh, I'm like this cool guy coming back to the home state with every possible toolbox and a PhD in pharmacology and all the fancy training. And Denver was kind of a big cow town then. And so I thought, like, what more? I've got it all going on. And within a few weeks, I was very humbled because my patients, I should have anticipated this, they were asking me, what herbs should I take? How should I exercise? What diet should I follow? What do you think of St. John's wort? And we actually did surveys back then. This is 25 plus years ago. And our patients were more devoted to those than the conventional MS therapies that I was providing. And I had amazingly gotten zero training in all these therapies that people were asking me about. And so
Right.
then I started using my fancy training to research answers to those questions. And it was stunning to me. Some of them, like exercise at that time, was determined to, it was classified as an alternative form of medicine.
Wow.
That should have been the
Number
part
one.
of the standard of care. I
Right.
learned nothing about exercise in my training.
Right.
And then some herbs the patients were using quite regularly back then had serious toxicity. People could actually have died from using some of these
Wow.
rarer herbs, and I had no understanding of that. So it became quite clear that my clinical practice could be the sort of the laboratory to find out what people with MS are interested in pursuing beyond conventional medical care. And then way beyond that, like, my gosh, you take an evidence-based approach to some of these therapies that were never talked about back then, and some of them should be part of the standard of care. And then
Right.
others, clinicians should be knowledgeable enough to tell people you probably don't want to pursue that or hear the risks of pursuing those therapies. So that became my career, to use that fancy academic background to relate it to the real life of what was coming up in clinical practice, and then to write books and articles and lecture and kind of share evidence-based approaches to people with MS, and then also health professionals.
Yeah, so I mean, there's so many things you said that really stick out to me. I mean, certainly one of them is what the patients are asking for. And in today, even very commonly, whenever someone comes in for that first visit and they're diagnosed, we may start talking about conventional treatments, but people absolutely want to know, what should I be eating? What kind of exercises should I be doing? And, our medical degrees don't really train us to do those types of things, or even about nutrition. I think nutrition was maybe like 2 weeks. My whole
My
medical school
first year in
training.
medical school, right?
Yes, it's like 2 weeks of nutrition. It's like, I don't remember any of it, So
Yeah.
it's kind of like, as a physician, you have to re-educate yourself, or educate yourself about these things so that we can, provide good advice to our patients. And as we were discussing a little bit before the show started, I'm fairly new to, I recommend things, but in terms of giving specific recommendations, you really I have to go out there myself and do the research and try to figure it out, to make sure that I'm giving people solid advice. And so that's why I was really excited to offer this show. I think the
For
other
me,
thing,
when I
go ahead.
first finished my, when I got into that dilemma, like 1 month into practice, I thought, oh my gosh, this is an area no one has taken this seriously.
Right.
And I thought I was finished with my training. It was 18 years. I thought that was the end, but it really was
The
5
beginning.
years more
Yeah.
after that to learn about herbal medicine and learn
Yeah.
more practical aspects of nutrition. So yeah, and I had gotten zero training in most of those areas.
Yeah. Well, I appreciate the work that you've done. Every symposium you do at our consortium meeting is packed, standing room only, because everybody's trying to learn.
Yeah, that's been rewarding. Health professionally, I think sometimes people think medicine never changes or it's kind of stuck in a rut, but I've been able to see over 25 years conventional medicine, thinking I had some psychiatric issues and why I like talking about this other unusual stuff, to people really kind of embracing it. And certainly our big MS organization for 20 plus years, they've been on it with educating health professionals.
Yeah.
I do think earlier we were talking about integrative medicine, like that's the topic.
Yeah.
And I think a lot of people don't even know what that is. So
Enlighten
I think
us.
the
Tell us about it.
understanding is kind of what I was hinting at with, I got the conventional medical training, but then when I came back here to Colorado, what people were asking about was, they wouldn't formally say it, but they were asking about lifestyle medicine. Typically, should I exercise? How much should I exercise? Also diet approaches, kind of emotional health is built in there, daily habits like especially alcohol and tobacco. So that's kind of lifestyle medicine. And then there's unconventional medicine. Those are therapies typically not available in hospitals, not taught in medical schools. So integrative medicine is the conventional medicine, lifestyle medicine, unconventional medicine, and bringing those all together in an evidence-based way.
Right.
Not getting wacky and doing weird stuff. The core of it really is evidence-based, like we do with conventional medicine. And then two other elements that I think a lot of people are not familiar with, and this took me a total mind shift for me when I got into this, was integrative medicine is about treating disease as much as it is about preventing disease.
Preventing.
And that's an
ounce of prevention is worth a pound of cure.
Yeah, right. And I think I had, certainly in my neurology training, I had zero training about prevention.
Right.
Like preventing people from ever developing a disease process. So there's much attention to prevention as treatment. And then the other element of it is sort of a collaborative relationship between the clinician and the patient. And I loved at the beginning of the program, I think you make a comment about how you're trying to encourage people to become an active member of their treatment team. So I love that. That's
absolutely. That's the goal.
Yeah,
that's
so
the goal.
Sort of one of the critical elements essential elements of
So let's go back to lifestyle medicine. So one of my Mitzi-isms or Dr. Mitzi-isms that I say all the time is that medicine plays a part, but there's also a part you as a patient play in your overall health, right? The medicine is not going to do everything, right? And I think now we're beginning and shifting, at least in the neurologic community, now that we have so many different treatments. Initially everything was really focused on treatment for MS because we only had limited options. Now we've got 20 plus options. And of course, we have a long way to go. We don't have a cure yet. But I think now the focus is shifting more toward lifestyle, right? What can people do to help themselves, particularly because oftentimes people feel helpless with MS because it's like, I don't know when it's going to strike. I don't know what the symptoms are going to be, so what can I do to help myself? So I really like this idea of lifestyle medicine. I talk to my patients about it often, but don't necessarily use that term. So let's focus a little bit on diet and exercise and how that's really an integral part of an overall or holistic healthcare plan for people with MS.
Yeah, so I think of those as sort of the highlighted lifestyle approaches. And then, you can know a whole lot about each of those, but then how do you kind of modify that, or how do you apply that to a specific disease process like MS? I think in the area of diet, that's very confusing. There's so much information out there. Like, how do you distill that down to something that's practical on a day-to-day basis? So with diet, I think of there are kind of 4 steps that that's how I kind of distill all of it down. So I think people hear about diet, then they often think, okay, so diet, that's nutrition. Those are nutrients and supplements. So I'm going to get on all kinds of supplements and, they're not going to hurt me. They're only going to help me. So that shotgun approach, that was very common, certainly 10 to 20 to 30 years ago. But we have all this evidence now that even modest doses of standard vitamins and minerals, they can do harm. So it's not like they're neutral or they're good. They can actually do harm for people with MS specifically. A modest doses of some of those supplements can actually activate the immune system, which could activate MS or counter the effects of MS medications. So with supplements, to me, really the only 2 to be especially attentive to are vitamin D and vitamin B12.
Yep.
And you can get levels of those. If the levels are low, then your clinician can order those, give you doses to take, and then you do follow-up levels 3 to 6 months later. There's the There are many supplements to be avoided, more than 300 supplements that could potentially have negative effects for people with MS because they can interact with medications or, like I say, kind of activate the immune system. And then the focus really needs to be not on supplements. It was kind of a wacky detour we got on for a few decades to think you could replace complexity of food with one molecule in a gigantic dose.
Right.
People who got us on that path have since apologized for making people think you could substitute supplement for food.
Right.
So on the food side, I don't think we're ever going to find the best diet for MS. But I think we already know the worst diet for MS, which is a standard American diet.
That's the worst diet.
So
I
if you
agree
just
with that.
deviate a healthy direction away from the standard American diet, that's certainly going to have general health benefits for people. And it could have possibly direct benefits, at least on the symptoms of MS, maybe even disease process of MS. So generally healthy diet. What does that mean? So it can be a Mediterranean diet. There's something called the TLC diet. There's a brain healthy diet called the MIND diet. So there are 5 or 10 best research, best evidence-based diets out there. Michael Pollan, he's recently written about psychedelics, but much of his past writing was actually in the area of nutrition. And he did us all a wonderful service by summarizing his 10,000 pages of writing on diet with, generally healthy diet is real food, not too much, mostly plants.
Real food, not too much, mostly
5 times a day in my clinic. So I don't want to follow a rigid diet.
Right.
That's the generally healthy diet. I put one extra word at the end. So real food, not too much, mostly plants, enjoy.
Enjoy.
You're not going to sustain a diet that tastes like cardboard and you really, it's healthy in your brain, but you really find it quite disgusting. So that's the healthy diet piece of it. And then the fourth area, which is easier for me to do on a program like this than to do one-on-one in my office, which is part of that Michael Pollan quote, not too much. We have growing evidence for overweight, obesity having negative effects on maybe MS disease process, but certainly on symptoms of MS. So the summary is vitamin D and B12, be mindful of any other supplements you're taking, a generally healthy diet, and weight management. So that's kind of the diet piece of it. The physical activity piece, same thing. There's never going to be the one best exercise program for people with MS. I think if we all had the opportunity, whether you have MS or not, or any other medical condition, probably the best exercise program is one that's designed with like a physical therapist who knows you well, knows your medical conditions.
Right.
So I think it's very unlikely that the best exercise program for someone is something that's written in some book, or even that it's a 1 hour yoga format that someone's put together even for people with MS or people with neurological, because people with MS are very different. So if you're able to work with a physical therapist, even just a few times, to come up with a individualized exercise program, that's probably the best one. Then you want to exercise 3 to 4 days a week, 30 to 60 minutes per session, roughly 2 to 1 ratio aerobic to strengthening. But also you want to do stretching and balance exercises, and also what Americans unfortunately leave out of the exercise, which other cultures often don't. It's just to relax.
Relax.
You get all these relaxation molecules produced with exercise, like why not ride the wave? And you can get your body to relax. So, and you don't have to get into some elaborate meditative state. You can just lie on the floor during or after exercise and just close your eyes and
rest your
take
mind.
it in. The relaxation.
Yeah.
They're unconventional exercise like Tai Chi, yoga, like sort of gets into more the unconventional alternative water therapy for people who have balance issues, and then one for people who really want to push. And I've got lots of patients who love this. Maybe part of it's Colorado, but I think some people just love pushing themselves physically. So high intensity interval training.
Yep, HIIT training.
So a couple dozen studies in MS, many showing benefit, and more than 1,000 studies in the general population. And even in my state, where we're so exercise conscious, I'd say most people where I bring up HIIT, high intensity interval training, they haven't heard of it. And then if they have a recent diagnosis, or if they have a diagnosis of MS, and I'm telling them high intensity interval training, their eyes like light up. Wow, I have MS, and you're telling me to do HIIT.
Right.
And you can modify it. The high intensity is your own, whatever the highest intensity is for you.
Right.
That could be walking as fast as you can, a short distance, or not even walking, using some kind of, it's typically with aerobic exercise.
Yeah. Okay. So a couple of things. So let's go back before we move on from the supplements. Let's go back to the supplements. So, I do counsel my patients exactly as you said. Vitamin D and B12, we know those have immune effects. We know vitamin B12, particularly if it is deficient, can have neurologic consequences.
Work all the world like MS.
Absolutely. So I have a lot of patients, though, who come to me with a nice big bag of things, asking me which ones are ones they should take, which ones are ones they shouldn't. You mentioned that there are roughly several hundred that are not good for MS. Is there a place where patients can maybe find a list of those to know which ones may be harmful or interact with their medications or not be good for them? Because I don't think I have all 300
We just met like 20 minutes ago, but you just set me up right there. So thank you.
Tell us all about it. Tell us where to get the information.
So one of my books,
actually
in most of my books, at the end of the book, there's a glossary, alphabetical of supplements that can have potential negative effects. So the latest book is Optimal Health with MS. There's a glossary at the end of that. And then I have a website, neurologycare.net. That's totally free, hundreds of pages of free information. A lot of supplements are on there. So you can find basic information about many of the supplements there as well.
What did you say the website was again?
Neurologycare.net.
Okay, good. So that's important because I don't have all 300 memorized. So,
I don't either. It's a little embarrassing. I pull my book out when patients ask questions sometimes. And the really unfortunate thing is that some of the supplements that clearly activate the immune system, there's really supplements people with MS should specifically avoid. Sometimes those are actually marketed for people with MS.
Wow.
It's really it's so wrong.
Right.
Where I see that the most is actually there's an Ayurvedic herb called ashwagandha.
I have a lot of people that ask me about that.
And that clearly activates T cells, and with MS, the T cells are too active. So you don't. What we want to be doing is actually decreasing.
Yeah, and that's often what I advise my patients. So I can't read the label sometimes on all the things that they're doing, but usually I say you don't want something that activates your immune system because your immune system is already overactive with MS. So if it is something that claims to increase immune function or activate the immune system, that probably is something you want to avoid because our whole goal is trying to decrease your immune system activity because your immune system is attacking you. And so it's doing the most or doing too much.
Yeah, that gets into, when people start using many different supplements and sort of have quite detailed plans about using the supplements, or kind of exotic diet approaches that are really hard to follow, can be quite expensive. There is a saying in the lifestyle medicine, integrative medicine area, using it in an evidence-based way, that it's difficult, but it's not complicated. And so I think people already kind of know 80 or 90% of what they should be doing. And it's difficult because you have to be motivated to keep doing the right thing. It's not difficult because you need all minutia, detailed information.
Yeah, which makes me think about, the diet piece that you were talking about. So, usually I tell people more fresh foods, less processed foods, shopping
Real
on the
food.
outside of the
Yeah.
grocery store, that type of deal, but every diet has its own, kind of nuance. And so,
Mhm.
usually people ask me, well, should I do this diet, or is there an anti-inflammatory diet? Or what should I do? And often, I say you have to do what works best for you. And I love that last piece that you put in after, saying that we need to enjoy the food. So whatever diet or exercise program you need to go on needs to be something sustainable for you. So you don't want to make a drastic change and then all of a sudden go right back to the standard American diet, which, as we mentioned, was the worst diet
Right. Yeah.
for anybody, whether you have MS or not. It's a pretty bad diet. But it needs to be something that's sustainable. And then, the piece about exercise, I do often recommend people start with a physical therapist.
Right.
So the move with multiple sclerosis is to try to make treatment individualized, right? So the goal of this is to make an individual plan for that person. And physical therapists can often, examine their strengths or their weaknesses, particularly if they've had relapses or symptoms that affect their walking or their balance, and really prescribe that individualized plan, at least for them to get started. And then the only caution I have for folks with exercise is that sometimes if they get overheated, sometimes those symptoms may come out a little bit. So you just have to monitor that, realize that it's not a relapse. And if you did too much, take a rest and maybe dial it back a little bit.
Yeah, I often say that if exercise was a drug, it would be the drug that I most commonly prescribed throughout my whole career. It's just amazing, all the benefits you get,
Absolutely.
potentially altering MS disease activity, but certainly
Yeah.
helping with lots of different symptoms. Also, I was talking about things I didn't get taught in all my training.
Mhm.
And this relates to sort of what you were mentioning there. The word fun never came up
Fun.
in those
You're
18
absolutely
years of
correct.
training.
You
Right.
are absolutely correct. Fun has
So,
never been a
some
part
of
of the
this stuff
curriculum.
it's sort of the soul of life. Like
Yeah.
most of us enjoy food, most of us
Yeah.
have fun moving our bodies. And I find it tragic. Sometimes I see people for second or third opinions who've told they must do this diet or their MS is just going to go out of control. And there's not evidence to support that one
Right.
diet, and they've kind of lost a joy
They've been
in life. So
suffering.
you really need to you take the evidence and then think about enjoyment and fun.
Absolutely. I love that. I love
Another
that.
area in integrative health, the 5 areas I kind of think of. So diet, physical
Yeah.
activity, those are sort of the big ones.
Yeah.
The third one is emotional health. And I think
Let's talk
often
about that.
in our country, we wait until people have severe depression or severe anxiety, then we start paying attention. But I think the diagnosis of MS, people want to figure out what kind of toolboxes they can put together to live a more enjoyable, flourishing type life, not just wait for depression or severe anxiety to come up. So emotional literacy, I talk about that a lot with my patients, maybe especially men newly diagnosed with MS who they're not given much emotional literacy training in our society, but it's
And
as
what
much
does that mean? What does emotional
that
literacy mean?
means most simple terms like identifying, processing, and expressing emotions. And that sounds simple, but so many people, I say what I just said, and they're like, "Can you say that again?"
Right.
Like it's not familiar territory, and if you've never been told that, how are you supposed to know when
Right.
you're 20 or 30 or 40 what that means? So that's very important, and that can give someone in their 20s newly diagnosed with MS, they get an emotional literacy toolbox they use the rest of their life. Wow, that's potent.
It's a game changer.
Fourth area is tobacco and alcohol. So alcohol in moderation or less. MS is like the millionth reason to not use tobacco. So moderation alcohol, no tobacco. And then the fifth area, which is actually the most important one to think about, and I talk with my patients about, but it's still, I think, a little under the radar. And it's such, I think, often a missed opportunity in the MS world is to keep the rest of the body healthy.
Yes.
We have all these studies going back, there's a lot of focus the last 5 years or so on MS and how it's negatively impacted by just one other disease, but the studies actually go back 30 years showing that. And MS typically diagnosed when people are in their 20s and 30s.
Yeah.
Often those people have no other medical problems. Like what a great situation to try to then work with these other 4 factors, the other 4 lifestyle medicine approaches to prevent other medical conditions. Like how potent is that? So of these 5 factors that can potentially affect MS in a positive or negative way, the best evidence we have, the most potent effect is probably with these other medical conditions that you optimally treat if you have them, but even better, you never develop them.
Yeah.
And that gets to, how do you do that? Or, that's kind of a big ask to be diagnosed with MS. And then like, how are you going to keep the rest of the body healthy? And I was surprised early in my career when actually it was the very first patient I admitted to the hospital in my training with MS. And she said, MS is actually one of the best things that happened to me in my life. She was in her 70s. She was way wiser than me. She was not highly educated, but she was very wise about how she had dealt with MS. And I heard that from multiple other patients. And then there's a study that was done a couple of decades ago at this point, but it so resonates with what I see in day-to-day practice, which is, it's really hard to change your lifestyle. It's hard to make these changes with diet and physical activity and pay attention to emotional health when maybe you haven't done that your whole prior life. So, people think of reading books about this. How do you make a lifestyle change, or New Year's resolutions, or watching TV shows. So they looked at people who'd made, this isn't MS, this is the general population. Who are the people, how do people make like a big shift in their lifestyle and have that be sustained for decades afterwards? So they found, 50 or 60 people, interviewed them. And what they found was they call it crystallization of discontent. So it wasn't the TV show, book, any of that stuff. It was something out of left field, some defined event out of left field, out of someone's control, also often related to health, with a huge negative emotional impact. And those moments, those crystallizations of discontent, fuel people to make
the
change. That's sort of
it's almost like a health crisis of some sort.
Yeah. And when I read that paper, crystallization of discontent, external threat, negative emotion, I thought, my gosh, that's how it feels in my office when I diagnose someone with MS. And that's what my own patients they'd been using different words, but my own patients telling me, like, this has actually been a gift in some ways. And they kind
to
of
help me get other parts of my life.
And then fast forward 25 years, some of the patients I met 20 to 25 years ago, they were in their 40s. I've been doing this my whole career. So now some of these patients, multiple patients in their 60s, come in and they say, it's the weirdest thing. I'm the healthiest 60-year-old I know. And I've had MS for 20 or 25 years.
And you've had MS for 20 or 25 years.
They
were taking care of
change their lifestyle, and they don't have obesity, high blood pressure, heart disease. And that's really, like I say, that's not, when I was younger as a clinician, I would have thought that was just idealistic mumbo jumbo. You're going to take MS and that's going to be a positive motivator, but it's real. And it's
but
potent.
It makes a difference. It's very potent.
And it can go the other way. It's sort of a fork in the road. What are you going to do with this diagnosis? Are you going to have the crystallization of discontent be a motivator to have a healthier lifestyle, maybe find more meaning in your life at a younger age than waiting till you're kind of in your 80s and not able to make much of a change?
Yeah.
Or is it going to kind of spiral you down? And I think that's where I find it most really rewarding as a clinician. Like, how can we as MS neurologists kind of be with people all through the course, but especially in the first year or two? How can we help you kind of get on take the good fork in the road and like milk the good that you can out of this unfortunate diagnosis? There is good that can come out of it.
Yeah. So going back to that newly diagnosed person, so very often, very early, we have conversations about mental wellness. So usually at that first visit, I'm talking about it. I'm saying, oftentimes people can get depressed after diagnosis. Let's talk about mental health counseling, right? So I'm a big advocate of counseling.
Yeah.
If we need medication, sometimes those are helpful. Those are tools that we can utilize. But sometimes we don't need those, but I definitely want people to have, that mental health support. And I think that's extremely important to being successful with any chronic condition, particularly with multiple sclerosis. And I think we don't focus on that quite enough.
I think there's still this stigma about
there's definitely a big
mental
stigma.
health. I kind of wish that we had, I think it's true most places in the country now, they're just gym, like 24-hour fitness, all these physical fitness gyms. I wish there was like mental fitness gyms.
That would be great.
To just have it become
just a part of the normal everyday
talk about, and
just as normal as you talk about going to your primary care doctor. I think the other challenge is, post COVID, a lot of our mental health services are overwhelmed. So lots of people aren't taking new patients, and so that's been the biggest issue I've run into. I recommend a counselor or a psychologist, and it's like they're not taking new patients. So that's something that also needs to be addressed. Well, we got a couple minutes left, but I want to get into a couple of other things. So, we talked about those 5 pillars, which are extremely important and obviously the foundation of lifestyle medicine. What about other things? People often ask me about acupuncture and biofeedback. Any thoughts about those practices and, how they may or may not be helpful with multiple sclerosis?
Yeah, so that gets into another area that it's like a 3-hour discussion. But,
well, we'll have to do a part 2.
That's right. So I talked about those 5 areas.
Yeah.
And then one other area that you kind of mentioned indirectly is just MS, disease modifying therapies. And then the one more, the 7th of these areas, is using integrative therapy to treat the symptoms of MS, not just rely on conventional therapies. So use the integrative approach with lifestyle and unconventional therapies. So certainly mind-body approaches, meditation, there's some particular unconventional therapies. I put biofeedback in that category. They're very low risk and they have potential benefit, especially with mood issues, stress, anxiety, pain, fatigue. So those symptoms can be especially amenable to sort of the broad class of mind-body approaches. You were talking earlier about acupuncture, and that same thing that can have potential benefit, especially for pain. That's where I would see that most frequently, but with MS can potentially help with fatigue. There's some limited studies showing benefit with bladder function. Same thing, if it's done correctly, I think of acupuncture as just very low risk and potential benefit if someone wants to pursue that. And that's a whole different way of thinking about the body. And we don't have all the answers in conventional medicine. So maybe there are different ways to think about the body. Importantly, with acupuncture, often at the end of an acupuncture visit, someone's given a baggie with traditional Chinese herbs in it. And unfortunately, many of those are quite immune stimulating. So if you're doing acupuncture, I do just the acupuncture piece. If you want to look up the specific herbs, I kind of gave references to the website book. There's listings of dozens of Chinese herbs to be particularly cautious about, but a lot of them we don't understand enough about them, and many herbs just generally activate the immune system.
And then meditation you mentioned. So I'm a big fan of meditation. I got into meditation during the pandemic. And one of the things that I really like about meditation is that often for my patients, many of whom have anxiety, can help with kind of not necessarily clearing the mind of thoughts, but helping us to kind of control, letting those thoughts kind of overtake our minds. And then I also found a lot of benefits with things like spasticity, because oftentimes people have spasticity related to multiple sclerosis. But on top of that, if they have chronic anxiety, they may be unconsciously tensing muscles. And so meditation and yoga often bring attention to those areas of our body where we hold extra tension, which may be worsening symptoms from chronic conditions like multiple sclerosis.
Yeah, so I think of meditation a little like physical therapy. It gives you, or doing your own home exercise program. So meditation gives you a glimpse into your mental processes, and you can certainly follow regimens for doing meditation programs. But I think a lot of people end up sort of discovering some things about themselves. They find out how to relax without doing the meditation. They figure out they can do some little thing for 10 seconds if they're in the middle of a meeting and they're getting really annoyed at someone. They can just sort of dissociate to a mini meditation and then
move
come
on
back in. So I think it gets back into just sort of understanding your mental, emotional processes as well as your physical processes.
Yeah. And so we said we need to do a whole separate show about this, but just give us a quick and dirty thought about cannabis and its use in multiple sclerosis.
Yeah, so there's some evidence, certainly not overwhelming. It's not like the master cure-all, but for particular cannabis products to be helpful for spasticity, especially in MS, but also potentially pain, bladder function, and sleep issues, but it's generally spasticity and pain. But even some of the formal clinical trials have not, these very well-designed studies with pharmaceutical grade products, even one recently has not found a benefit. But cannabis has, like any drug, cannabis is a drug, and it has potential negative effects. So, ones that concern me are drug interactions. CBD has more drug interactions than THC. So a lot of people think CBD, it's over the counter, must not be drug interaction. There are a lot. One I see most often is liver toxicity. Then THC products, addiction, psychosis, worsening of mood issues. So it's quite a long list, and you got to be mindful of what medications you're taking, what other medical conditions you have, and then dispensary products in our country, there are many studies showing the labels are not correct. There can be contaminants with pesticides, heavy metals. So it's quite a complex territory, as we were talking about earlier. So people really need to know what they're getting into. On my website, there's detailed information people can find.
Okay. All right. Perfect. All right. So I don't see any questions in the chat, but as we are kind of wrapping up, tell us just about some kind of final thoughts, and also tell us where people can find information. I did have someone put in the chat the website neurologycare.net and the last book that you mentioned. But, if you could give us some kind of final thoughts, and then, tell us where we can get or where our patients can get more information about the stuff that we discussed today.
Yeah, so I think that the integrative approach can really be a way that you can have your own control over the MS. You can put your own life into the equation. I think it's frustrating with MS that it's about the immune system, but we don't have ways to turn down the immune system in an obvious way. So I think it's a way to have control, make decisions that can ultimately have good effects on MS. And like I say, to think through how MS could be leveraged in a good way in your situation. Sorry.
That's okay.
Sorry about that.
That's okay.
And then, sorry about this.
That's okay.
Just
That's
got a
okay.
cold.
No problem.
But then the website, the book I mentioned, National MS Society, MS Foundation, MSAA.
Yeah, so those are great sources of information. So the book was Optimal Health with MS, and that's a book that you wrote, and you've written 4 other books as well. But that's the most recent one. And then neurologycare.net is your website where you have tons of information, including those 300 supplements that may activate the immune system.
Many of them are there, yeah.
And may not be as good for MS. And I think, again, my goal with Brain Chat and a lot of the work that I do is to try to empower people living with MS, right? And so I'm really excited that our community is now focusing more on lifestyle medicine. I think this is a key component or very important, if not one of the most important components of people living well with MS. And again, the medicine plays a part, but it really puts that power back into, the individual's hands so that they know there are things they can do to help themselves and to live well with multiple sclerosis. Well, I thank you so much for coming on
and the invitation.
Yes, and sharing your expertise. So we'll have to do a part 2 about cannabis, because that's a whole show in and of itself.
Lots of detail there.
Yeah, but thank you so much for joining Brain Chat. Thank everyone for viewing the show tonight, and we'll see you again next week for our next episode and our end of year wrap up. Thanks everyone, and have a great evening.
Great. Thanks so much.